Good evening, Chicago. This is Jerry Vasilatos, along with my co-host, Lainie Petersen.
Hello, Jerry. It's good to see you, and hello, Chicago.
Welcome back. It's good to see you again. We saw each other last week, but I'm really glad to have you back on the show because I always know when you come on, the burden of finding the stories and doing all of the on-screen filibustering, not filibustering, but all of the on-screen reporting and commenting, I can put on your shoulders for a little while I comment on it. Because we've got a motherload of a show today. You've got a lot of really interesting and exciting stories, relevant and important stories also to share with our audience tonight on what I am christening as the return of civically minded Chicago.
Yes, thank you very much. I do believe, though, Jerry, you did have an important story that you wanted to mention briefly at the top of the show.
Yeah, so there is. I want to let everybody out there know with this Delta variant that we're facing right now in the news, I had a scare myself. Someone I'm very close to who was vaccinated reported to me this past Saturday morning that they had COVID. And I saw them on Friday, and both of us are vaccinated. Mm-hmm. So first of all, I'm so utterly, completely concerned for their welfare, and I was very appreciative that they shared with me that they had rapid tested Saturday morning after dealing with some flu symptoms that they had last Wednesday. They went in for the regular test, but it took too long to get results, so they went back Saturday morning for a rapid test and found out they had tested positive. And this, of course, prompted me to go get rapid tested on Saturday because I saw this person on Friday. Luckily, my results were negative, mm-hmm. which ruled out the possibility that my attendance at some events the previous weekend where there were crowds could have been the exposure that I may have been involved in that could give me Delta. But I am going to go and rapid test again tomorrow, because as my exposure to the person who got Delta last Friday will then be within the 5 to 7 day range tomorrow, I want to make sure that I didn't pick up Delta from them, given the incubation period. Sure. So I guess, Lainie, why I wanted to share this with everybody, for all the bitching I do on this show, and I really rant about it a lot, and some people think that I'm going overboard with it. It's nothing to laugh at. And the only reason that this other person, I think, is faring well is because they were vaccinated to begin with. I got into it on Twitter with someone who said, well, it just proves to you that the vaccines don't work because you're always going to get it. And I was trying to impress upon this idiot that the fact that they're not in a hospital or on ventilators because they build up the antibodies from the first vaccination that they got to combat against this Delta variant. So people have got to understand, just because the Delta variant is out there and people who are vaccinated are catching it doesn't mean that the initial vaccination failed. What it did was it built up people's antibodies to combat the Delta variant. Now, the person I know lost their sense of taste. Thankfully, it's coming back today. And also, thankfully, they're in very, very physically fit condition. They take care of themselves. So, I'm so very, very grateful that they're safe and they're getting better, but they've had to quarantine for a week now. Yeah. And they have 2 children that they had to worry about exposure to them. And this kind of leads into our first story that I'm going to pass along to you regarding Chicago suddenly reinstating the indoor mask mandate due to rising COVID-19 cases. So I wanted to lead with that to tell people, when it's personal and it hits you, mm-hmm. there's no better way to try and impress upon people how serious this is. That you get vaccinated to begin with, you stop politicizing it, you stop letting religion guide you as far as, you're going to be safe because, you might have whatever religious beliefs that look, we've been vaccinated when we were young for chickenpox, for measles. Previous generations were vaccinated for polio. These weren't politicized situations where people argued against the value of vaccinations to help combat and protect everybody, because everybody got a vaccine. And I go back to realizing this past year with our election cycle, so much was politicized, and still you've got people on the extreme right who are against vaccinations, and you've got people on the extreme left who don't seem to have any any compunction for people's reasons for maybe slowing down on it, although people need to wear masks or get vaccinated. I just, the whole politicization of this is just, it's ridiculous. It's not politics. It's science and medicine.
It is really upsetting. I mean, just to interrupt you, but
Sure.
it is really upsetting to see people virtue signaling
Yes.
one way or the other on the basis of not on what they understand the science behind the virus and the illness, but getting into they want to show whether they're allied with Donald Trump or Joe Biden, or
Yep.
are they a green, or are they even further to the right? And it is really disturbing to see this, that people are making these decisions based on what they want to signal to others rather than an understanding of what is best for their health and what is best for public health.
This isn't about tribal politics.
Yeah.
And I keep quoting something I heard Bill Burr say in one of his podcasts, a comedian I hope many people are familiar with.
He's great.
He's hilarious. And it's like you wouldn't go to your mechanic and have your mechanic tell you, there are 4 lug nuts missing from your wheel, and I really don't recommend that you drive until you get this fixed. Would you tell your mechanic, you're full of it, I'm just going to drive my car, you don't know what you're talking about? That's how people are treating medical professionals regarding a virus that they went to medical school and understand science and medicine about. Sure. And not being able to understand the simple breakdown of the initial vaccination is going to help you build up the antibodies and the immunity to combating the mutations of the virus that would kill you if you didn't have the vaccination. That's what it comes down to. Stop the tribal politics. Stop the my body, my choice bullshit, because that's exactly what it is. Your body, your choice, fine. Then stay away from me and stay home. If you don't want to wear a mask or get a vaccine, just because you want to kill yourself or expose other people because of your beliefs, your tribal beliefs, it's selfish, it's narcissistic, it's reckless, and it's dangerous. And as we talk about the city reopening, I'm just going to go back to what I've said endlessly in previous broadcasts with Kit and other guest hosts. If it's a necessity to get out of the house to do something, go ahead and do it. If it's an indulgence, think twice and stay in. I mean, I even feel a little bit guilty of having gone out to that comedy show a week ago, because even though we wore our masks in and we wore our masks out, there were a lot of people at that show in that room who took their masks off for comfort. And, that's, I mean, I admit I broke my rule. I took my mask off sitting in that seat because I had the false security feeling, well, I'm vaccinated and I wear my mask in and I am distanced from other people in the room. Doesn't matter. Does not matter. I'm going to pass it to you, Lainie. I've said enough.
Sure. Well, the big news today that did come down is that we're seeing, I believe it's over 400 cases a day. So they're going to be reinstating the indoor mask requirement for people, whether they're vaccinated or not. In the city of Chicago, they've also updated the travel alert list to added 8 additional states. Now, one of the things, I mean, I don't know that there's much more to be said about the indoor mask mandate, but what I would note was that a retail association came back and said, look, these requirements should be placed on individuals, not businesses. And one of the points that they made is that there are people out there that become very hostile when asked to comply.
Yep.
And there have been any number of cases, which I have reported on Civically Minded National over the past year or so, of people physically assaulting store workers. There was one guy who punched out a 17-year-old worker down at, I think it was at Disney World. And the kid had to go in for reconstructive surgery. This is, so this has been happening. All of people are popping off at each other. I know from friends who work either in retail environments or who are working in restaurants, bars, that sort of thing. It's very difficult for them because they are targets for angry people who blame the person who was put in the position of enforcement. Now, a lot of these retail workers, a lot of these hospitality workers, they didn't sign on to be security guards. They're not in that position. They're not trained for it. They're not physically set up for this sort of thing. And instead they're getting these confrontations that in some cases are just incredibly hurtful. In other cases, they turn violent. And one thing that happened across the country was that many major retailers said, Yeah, we're going to have our mask requirement. No, we're not going to enforce them because we have no way of protecting our workers against physical attacks. And so, we're right now, Chicago, we've got a lot of tensions here at this point. And one thing that I am concerned about with the mask, and I'm not speaking against masks, I'm saying that for every kind of policy that is supposed to protect people, when it comes to things like this, there's oftentimes unintended consequences. And we might once again start seeing additional conflicts that could get even nastier as time goes by. We're going to have to see what's going to happen. I think it's really quite distressing, and I do think, honestly, if you're the sort of person that is on edge and you're going to get angry about a mask requirement, yeah, I do think you ought to stay home. If you can't behave yourself in public, stay home. But I think there is this risk here in Chicago. So I did want to mention that because it was the big story today.
It's such a lack of respect for other people. I mean, maybe it just has to do with the fact we were raised right, Lainie.
Well, you and I suspect we are old school folks. Hugh,
but young at heart.
Young at heart. We're Gen Xers, but I think that we were brought up that you don't hit other people, unless it's in self-defense. Keep your hands to yourself. Don't hit people. If you're upset, you try to work things out reasonably. You walk away, but you don't hit, you don't bite, you don't pinch. Just don't do any of these things. But a lot of people never quite got that message. But also the fact is that you don't punch down. That the fact that somebody is in a subordinate position does not mean that they're subordinate to you as a human being. And the fact that people think that they can take out their frustrations on a global virus, out on hospitality workers, retail clerks, people who are oftentimes, if they're not working minimum wage jobs, they're often working jobs where they're not being paid very much. They're not getting a lot of compensation. They're putting themselves out there and they're enduring this kind of treatment. And, there's been a lot of complaints saying that many businesses are having a hard time hiring workers. Well, there's a good reason for that. They don't want to be treated badly. And they're afraid. Shouldn't be happening.
No. Should I run the WGN video from the screen that we've got up right now? Because I know it was part of our show notes and it had to do with the story you were going to be reporting on.
It does. If you want to, that's fine.
Yeah, let's run it real quick. I've got it up here. And I got to bring the volume up. Sorry, everybody.
The mask mandate comes amid a rise in COVID cases, especially among unvaccinated Chicagoans.
WGN's Rob Sneed is live at City Hall this afternoon with when it takes effect. Rob.
Good afternoon to you both. Now that mandate starts officially on Friday. It applies to bars, restaurants, and common areas. Right now, we're talking about 419 COVID positive cases per day in the city. Now, Dr. Arbery with the Chicago Department of Public Health said this rule includes those fully vaccinated against the virus. 200 cases per day was the threshold that triggered the current mask mandate recommendation. But now cases are over 400 per day, which triggered Friday's indoor mask mandate. As of August 12th, new cases are up by 21% compared to the previous week. That's an average of 419 new cases per day, as we mentioned before. 95% of those cases in Chicago are the Delta variant, according to Already. Now, 296,678 total cases right now, and 54.2% Chicagoans are fully vaccinated.
Only 54%. So I want to share something that came from Block Club Chicago regarding Arwady. The return of the mask mandate comes as the city sees a surge of COVID-19 cases fueled by the more contagious Delta variant. Dr. Allison Arwady, head of the city health department, said other restrictions are not expected at this time, and public schools will return to in-person learning as planned come August 30th. Quote, we're hopeful that having the mask in place for everybody will get us through Delta while we keep working on getting folks vaccinated, Arwady said at a news conference. Our goal is to remain open but careful. Masks will be required for all people, including those fully vaccinated, so long as they're 2 or older and indoors in a public place like a restaurant, gym, or common area in an apartment building. I don't believe that requirement is going to be instated in schools. Have you heard otherwise, Lainie?
I have not heard otherwise, but I have not been paying attention to that. I don't have kids or anything like that, so it's.
I know people. There are parents arguing against it as much as there are parents arguing for it.
Yeah.
Mayor Lori Lightfoot said in July the city would consider bringing back a mask mandate if Chicago consistently saw more than 200 cases per day. Instead, when the city passed that mark a few days later, officials simply recommended people start wearing them indoors and in public. Now Chicago is seeing 419 new cases per day on average. Already said that's still significantly lower than during prior waves of coronavirus. During the first wave in the spring of 2020, the city saw an average of about 1,000 new cases per day. That fall, there were about 2,500 cases per day at the peak, she said. Chicago seeing 400 cases per day is quote unquote concerning. It's why we're acting, Arwady said.
Yeah.
But in terms of where we've been as a city, it is not a cause for alarm. It is a cause for caution. Meanwhile, I don't know if you saw this in New Zealand. Now, granted, New Zealand is an island,
It's an
but
island.
they're locking down after discovery of a single virus case.
Yeah.
New Zealand entered a nationwide lockdown Tuesday after a single coronavirus infection was reported, the first confirmed COVID-19 case in the country in the past 6 months. They obviously handled the initial lockdown pretty well to have lasted 6 months without any other cases. Prime Minister Jacinda Ardern defended the move in a televised press conference, saying officials have seen what happens elsewhere if we fail to get on top of it. We only get one chance, she added, according to the Associated Press. The best thing we can do is get out of this as quickly as we can, is to go hard. Now, can we shut down the entire city like New Zealand? Of course not. Can we perhaps be more consistent in what Arwady and the city is recommending in how fast we've opened up? I think so. I mean, they're still defending Delta, I should call it Delta-palooza. And the fact that they're not insisting, well, actually, I should say E. Heller helped coin that phrase, I think. But yeah, when you see other countries looking at the U.S. who have had much better success in controlling this, and of course we've been so rushed to reopen because our federal government just never wanted to provide the full support for people that were forced to stay home during a lockdown, or the support to businesses so that they could stay afloat and survive while they were closed down for a reasonable amount of time. This is what led to the rush to reopen. And this is why we're seeing this mutation, the Delta variant, on our doorsteps now.
Well, I mean, I would agree with you, as we talked about in the earlier, that New Zealand is an island, so it's a slightly different situation. I would say that New Zealand, I think, also there's a lot more trust in these countries. There's reciprocal trust between the people who live there and the government and each other. And I think that in many countries there is a lot more trust than what we have here in the United States. I think in the United States, there's a very low level of trust. People pay taxes and whatnot, but they don't always necessarily see the benefits from what they're paying into. And I think that we're suspicious of each other. And that's exacerbated by a variety of things, I would say, including social media. But I think that there's different attitudes around the world to what's been happening, and I think that the U.S.'s attitude that we're often encountering probably has a lot more to do with what we think of each other and our government.
I think you're absolutely right. I mean, how much trust can you put in a government that just spent 20 years and $2 trillion doing nothing in another country that constantly also tells us we have no money for Medicare for all? We have no money for reduction of student debt or giving free public college so we can enrich our young people's lives for the future of America. We have no money for infrastructure. We have no money for to house the homeless when we have more housing than we have homeless people. Why would you trust our government when they tell us we have no money for that? But we have a
$2 trillion paper tiger. We had a paper tiger military and government over there that completely crumpled, I should say, because it's paper, after, countless lives lost. Really quite distressing.
Absolutely.
But yeah, so, that is, I guess we'll be keeping people posted here on Chicago Corner about what's going to be happening. We do need to move on, though.
Yes.
You pointed out, I got a lot of stories this week. One story about last time I was on the show, probably a couple months ago, we had a show on disaster prep in Chicago, and we discovered that we both owned the same weather alert radio. It's a model by Midland, And those who want to go into the show notes, you can actually check out, I've got a link to the video where we're showing each other our Midland radios. And the cool thing,
there it is from our last it's actually subclipped on YouTube, so people can find just the segment on the Midland Emergency Radio.
Yeah. And the cool thing is that it's a radio that acts like a smoke detector or a carbon monoxide detector, but only with weather disasters. The National Weather Service has radio stations and transmitters around the country. And when any kind of a weather disaster or weather alert, a watch, an alert, any kind of weather or non-weather emergency happens, it sends out a code, EAS code through that transmitter, and that triggers the radios to go off with an alarm. You push a button and you get a computerized report on what's happening, what you need to do, how long the conditions are expected, why they're reporting the conditions. They'll actually tell you the source of the information, that there's a tornado coming or something like that. In any case, last week we had some really horrendous weather. We just days and days of tornadoes and tornado warnings and thunderstorm warnings. And so what I began to do was I was testing my radio against both the city and the county text alert programs, because the Cook County has a text alert program that will also send a message, text you a message to your phone to let you know that a disaster happening. And the city of Chicago also has that service. So I began to test my radio against those services. And what I found is I was getting my alerts through the radio, in many cases, anywhere from 1 to 3 minutes before I was getting the text alerts from the county and the city. And when it came to a watch that was happening, the radio actually sent me the notice 10 minutes before the city's text came in. Now, I'm not blaming the city or the county for this. I think this has to do with the technology and the networks. I think radio is pretty instantaneous. Whereas if you're doing stuff online or with text, that's going to take a little while. But I wanted to let people know about that so they could make their own decisions about whether they want to invest $30 in one of these radios, if that's important to them. Now, we don't live in Tornado Alley, so that minute or 3 minutes probably doesn't necessarily matter so much. But if I lived in Tornado Alley, I probably would want that advance notice. And number two, I would also point out, if you have people in your household who are disabled, elderly, children, you might want that extra time so you can make decisions. But I wanted to bring that up, kind of follow up on that story we did a while back, because my own personal test showed that the radio really is Johnny on the spot with those warnings.
Yeah, it makes sense. I'm glad I've got my radio. My siblings and I used to kind of poke fun at my dad because he's the one who bought them for us. And it was always sitting in the cabinet, and I'm like, I may as well hook it up. And I have it in the kitchen, and it is. I mean, the moment we have a weather alert, I hear the mop, pop, 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 pop from the kitchen, and there is a tornado warning in Cook County. And I mean, at least although we're not in Tornado Alley, I do feel a little bit more safer and secure knowing what's coming to prepare if I need to. And I do think that it makes sense having the radio as opposed to the text messaging, because literally 3 minutes can make a difference. And I do have the link that you shared with me, and it's also in the show notes, where you can sign up for the Cook County Alert text messaging. And then we've also got
the Chicago.
For Chicago. We've also got
weather.
Do I have the right link? And we've also got the alerts from Notify Chicago.
Right. The National Weather Service does advise people to have multiple ways of getting information. So absolutely set your cell phones to receive warnings, and you can do that. You can check. It was either Android or iPhone. They have different instructions, but you can actually go into the control panel and select to receive those notifications. The other thing that you can do is sign up for those text services, whether you're here in Chicago or you're elsewhere. Have the weather alert radio, have multiple ways, because the transmitters for the radio stations can go down. In fact, that happened for a while in central Illinois, not so long ago. And but the National Weather Service says have multiple ways of getting information, and also to remember that even if your area in Chicago does have this outdoor sirens, that the outdoor sirens were engineered and designed to be heard by people outdoors, not indoors. The fact that you can hear a siren indoors, that's very nice, but that was not the way they were designed, and they should not be used for that purpose, relied on for that purpose.
Understood. Thanks for sharing that information with the test that you conducted.
Yeah, absolutely. And I'm going to keep on doing because it was very fascinating just to see the real differences there. Also wanted to move on. There was it was some good news, actually, a bit of legislation. It was passed in Chicago. It was I think passed through both houses, and the governor did sign it into law. And what it is going to do is it's going to make it a lot harder for businesses in Illinois to force employees to sign non-compete and non-solicitation agreements. So non-compete agreements it's part of the employment contract where if a person decides to go work for a company, they are agreeing to not go, if they leave that company, they're agreeing to not go to a competitor for a certain period of time after their employment ends or is terminated with the original employer. Non-solicitation is that you agree that if you leave the company, that you will not try to solicit any employees to come join you at that company, or you will not try to solicit people, third-party businesses that worked with your former employer to work with you or work with your new company. The problem with these agreements is that they can really hold people down. That a person who was working in an industry, they're working in that industry, and they may not be able to find a new job, which can make it very difficult for that person to bargain for a salary because the company knows that they have that person over a barrel. They may feel obligated to stay there if there are no employers that want or need their skills, and it can be a really difficult situation for people who could be trapped by these clauses. Now, I think initially these non-compete and non-solicitation agreements were intended for white-collar employees who might be somewhere up on the management chain. They may actually have some knowledge of trade secrets and competitive intelligence. But what's happened is that you've got companies like Jimmy John's forcing employees to sign a non-compete, saying that they cannot go and work at another sandwich shop for a certain period of time, which is absolutely absurd.
Yeah.
So essentially, this has been largely addressed, and it's not a bad. Even Crane's Chicago Business, which is very pro-business, but it seems to think that it's a good bill. Essentially, what's going to happen is that your employer cannot require you to sign a non-compete if you're making less than $75,000 a year. They cannot require you to sign a non-solicitation agreement if your salary is less than $45,000 a year. Also, you're not required to sign it immediately. You've got 14 days to think it over, to look it over, and you're also advised to consult with an attorney.
Well, it's good to hear the state is doing something here to actually help workers rather than penalize them.
Well, yeah, I mean, it's just incredibly abusive. I mean, and some people, even in the business realm, are saying, look, there are very few employees at any company who are going to have knowledge that could really seriously hurt that business. You're going to have very few people. They're going to be near the top, and they're probably going to have the financial resources to take time, between jobs. And that's a possibility. But the idea of taking somebody who is making sandwiches or performing, some kind of entry level task and basically trapping that person at that job, because if they try to leave and they want to go into something in a similar industry where they're more likely to get hired because they have the experience and the skills, and saying, no, you cannot do that unless you wait 6 months to a year for somebody who was probably not making a living wage to begin with, that is abusive and should never have been happening to begin with.
Well, pro-labor advocacy. Who would have thunk that the state would have passed this? This is good to hear.
Yeah, I think it is, and it's generally speaking, everything that I've read. There's some good articles about it. here on the in the show notes. People can check out. One of the things they're also pointing out is that there's been this thing called the Great Resignation, that many people are leaving their jobs entirely. Sometimes it's because they've relocated. Other people have been reconsidering their lives. I mean, they've had this time out. Not everybody has had the time out. Some people have been frantically leading lives of desperation, trying to scrape up enough money to continue living. But some people have kind of had a time to, to rethink and reset, and are leaving companies at this point. I would like to see a much stronger labor movement in this country. I don't know that that's going to necessarily happen, but it does please me to see, at least in Illinois, that people are becoming aware of how abusive these non-compete contracts can be.
I've never been a huge fan of Pritzker, but we never would have gotten this under Rauner. So kudos to the governor and the legislature for passing this.
Actually, I think that Rauner actually himself was concerned about it. I think it's just taken a
was he?
while. Yeah, I mean,
Okay.
it's really egregious. I mean, again, if you're running if you're running a sandwich shop, and what is the employee going to do? Let the other competitor know what kind of mayo they're putting on your sandwich? That is simply abusive. It's a way of holding a worker down. Some people compared it to indentured servitude. The point is that you can never really leave that employer unless you've got a major change in your circumstances, and you can't even negotiate for a change in your circumstances, like a better schedule or a higher salary, because the employer knows that you can't go anywhere.
Well, I don't want to go too off track here. I never got the impression that Rauner was very pro-labor. That's why I wasn't aware that he was somebody that may have been.
I want to say that he was concerned. I may be wrong, but I remember reading something that he was concerned about it. He did wear flannel shirts. Don't forget about that.
Okay, fair enough.
Also, I wanted to the story on WTTW, and it notes that 1 in 7 students in Chicago public schools experiences homelessness. Should
we play the segment, or will you?
Well, we'll talk about it. We'll talk about it a little bit. What I want to point out, though, is we talk about school performance, and people tend to criticize teachers and administrators. And look, there's a lot of blame to go around when schools aren't and their students are not performing as they should. But I think that this is kind of information that you need to take into consideration before levying a criticism.
Definitely.
When you've got children who are homeless, they are living in cars or vans. They are living in homeless shelters, which are oftentimes not great places to be, or they're housing insecure. They're sleeping on sofas. They're moving from house to house. It is very difficult for these kids to be at their best in school, even kids who are very bright. It's demoralizing. The kids are probably not getting good night's sleep. They may be hungry. They may be ashamed of their situation. And this is the sort of thing, this is a kind of problem. Homelessness in general needs to be addressed. You and I have talked about this quite a bit in the past. But when we have these kids, and we have such a high proportion of kids in our school system here that are experiencing homelessness or are housing insecure, that's a real problem.
I like to use this word a lot where I feel it applies. It's obscene. Yeah. It's obscene that kids have to, especially with the amount of housing that's available, unused housing, and we still just can't figure it out. Yeah. Can't figure it out how to help. I mean, anybody who's homeless, let alone children, dealing with this kind of insecurity.
Yeah, and it's said, homelessness. If you say it's obscene, I think I say it's a disgrace. I think
I tend to go a little bit further sometimes, but
I think we both express the same sentiment.
Yeah.
Homelessness is a problem that exacerbates other problems and creates additional problems.
Yep.
And
we don't deal with it we don't deal with it direct. We deal with it afterwards, which is more expensive and is at the cost of people's lives and health and everything else.
Yeah. And when you have one of the things that happened during gentrification, for example, in many areas, as the SRO, single room occupancy hotels, were closed down to make things, well, nicer. What it did, of course, was just put people out on the street. And then people start complaining about people living on the street. Now, people should not be living on the street because that is a health and safety problem. But the thing of it is that when you close down the housing options that are available to people who have very limited income or have a very difficult time with executive functioning, meaning their ability to manage their day-to-day lives, and putting people into shelters, which are usually one size fits all programs. You're expected, for example, to be out of the shelter very early in the morning and in the shelter late at night, which is okay. But what if a person has to work? I mean, remember, at one point I volunteered in a homeless shelter, and lights out was at 10, and you were woken up at, I think it was 5. You would have breakfast, you would be given a sack lunch, and you'd be out for the day by 7. But we had a married couple living in that shelter who both worked at McDonald's. They were both working, and they were trying to save up money to get into housing. And they had to be there, I want to say, at work at around 4:30 in the morning because they were doing breakfasts. Well, that meant that they were getting maybe 4 or 5 hours of sleep. I remember, I've never seen people so tired in my entire life.
Jesus.
And there was no way to get them into the shelter, say, for example, after their shift so they could sleep during the day. It was just absolute madness. And I was seeing that, they seem to be losing ground all the time. I've known other people who have, say, for example, severe back problems. They're on disability, and yet they're expected to sleep on a shelter bed where they're not going to be getting much sleep because it's very difficult to sleep in a room full of other people. And the beds are not suitable for this person's back, and everything. Again, this person was losing ground at this point. So I think the shelter system is something that has to go in this country. And I think there has to be a move to getting people either into treatment followed by permanent supportive housing, or find ways to ensure that there is affordable housing in communities all over the country. But it's when it comes to these kids, again, how can we meaningfully talk about the performance of a school system when 1 out of 7 students is dealing with homelessness or insecure housing?
I think we've seen this, at least on my radar, I've seen this most egregiously in Uptown under Kappelman.
Yeah.
Because, those developers just had to have those properties where they eliminated and tore down all the SROs, drove people under the viaducts, and then residents wanted to see them moved away from where do you put them? If you've eliminated affordable SROs in Uptown, where are they supposed to go? You just keep pushing them out. We're not dealing with the problem. We're just pushing it away so that the developers can continue to get rich everywhere.
That you have the people who are unhoused. They're dealing with this, but then you've also got people in these communities. It's more egregious, I think, on the West Coast, but who are living, the residents that are living there, and they've got people living on their streets, people in some cases who are mentally ill, who are using drugs, who are violent, who are leaving needles, who are using the streets as toilets. And then the people in the communities who complain about it, the so-called housing activists and anti-gentrification groups point their fingers at these people and say, well, you're just being elitist, even though the people living in those communities are themselves usually renters who are going day to day, who just don't want to live in a community where they feel unsafe or where they're dealing with possible disease because their sewers are being used as toilets. You've end up pushing the problem onto the individual people who are unhoused, and then onto individual community members who are not in a position to fight back. And the government does not want to take any kind of responsibility for these people, getting these people into homes and figuring out how to get them into homes and keeping them in homes. This could have all been avoided a long time ago. And instead, it's only gotten worse.
Well, I think what we look back on and see preceded this was, couldn't go back as far as like the Reagan administration and defunding mental health clinics all across the country. Now in Chicago, under Rahm Emanuel, of course, we shut down a lot of other mental health clinics. You've got the income insecurity, and you've got medical bankruptcy. Kit talks about, and Daniel talk about this a lot over on the Hard Lens Media show, along with yourself. These are all the factors that people are ignoring, blaming the homeless for being in the situation they're in, without recognizing the larger causes of the problem that are ignored. We have money. We pay taxes that are supposed to fund mental health clinics. Our taxes are supposed to go towards providing some kind of social security net for people that are less fortunate than us, and it's just not happening. It's just not happening. And this is what we're seeing here with these homeless students, or those that are suffering from the housing insecurity, is just another example of that.
Yeah, there was a lot that was happening. It happened here under Reagan and under Thatcher. There were movements on multiple sides, and it wasn't just a right-wing movement. There were also there was a lot of concern that there were people being warehoused in mental institutions. Sometimes they were just inconvenient or eccentric, or people that could have been living in the community. In the UK, they called it care in the community. But what happened was that they were treating everybody alike. And so you had people who really could not take care of themselves being mixed up with people who might just be different, and were being placed out into the community with minimal supports. And that happened all at once. Now, I mean, again, there are serious human rights issues when it comes to incarcerating a person against their will, who have not been convicted of any kind of a crime. And so I think that is something that has to be grappled with. But when you have a person who is clearly unable to manage their own life, that is, there's some hard decisions have to be made there. But I think in many cases, there were maybe people that would have been able to manage their own life, but they fell through the cracks, and then their condition deteriorated to the point where now, if you give them a home, they're going to need some kind of permanent supportive housing. Whether, if you had addressed their issues 5 years ago, gotten them into a rehab program, gotten them proper medical care, helped them with a job, and helped get them to get into some kind of subsidized housing, they might be doing good. But now their condition has deteriorated. We've just let this go for far too long, and now it's a predicament rather than a problem. And predicaments mean all you can really do is adapt. You can't really solve it.
And it's rolling downward on our students, as the story that you reported. Really quickly, one of the activists I had on last Friday's show has some relationships or connections with a lot of people in the homeless community here in Chicago. And I'm really hoping that we can put together a show that is a homeless panel dealing with the struggles and the challenges they're facing, what they're dealing with, what we hope that we can do. Hopefully that's on the horizon. I don't want to take up too much time, because I know that there's another story you want to move on to.
Sure. Well, and it's kind of in keeping with this. It's kind of a great story. What's happened here is that there's been more legislation that has passed in Illinois. Now, it has not, it's a relatively straightforward bill that basically is going to allow community colleges to open housing, whether they be residential halls or some kind of apartments. Previously, community colleges in Illinois were not allowed to do that. They might work, try to get some adjacent property and work with the foundation. But now the community colleges themselves will be able to develop dorms or student apartments. And I think that this is critical, because many people who go to community colleges are going there for, say, a trade education. They are going there because it's the most affordable option. They may be the first people in their families to be pursuing higher education or trade education. They may be folks who, are not ready for a four-year institution. But one of the problems is with community colleges, if you don't have housing on campus, you don't have that kind of immersion in campus life. You're going back and forth, you're commuting. If you have kids, if you have a job, you're even further disconnected, and it can make it harder for you to complete your degree. And one of the cool things about going to a four-year school typically is that most four-year schools, they have dorms on campus. and you get into the dorms, and pretty much everything's taken care of for you. I mean, you bring your linens and your clothes, but you're not worried about paying bills every month. You're not worried about your Wi-Fi. You're on a meal plan, so you're fed while you're there. And for many people who may be financially struggling, coming from difficult circumstances, what a great thing would it be for them to be able to go to that 2-year college where they're getting, either a certificate or a degree, and actually be in a campus apartment or dorm where things are taken care of. Everything is nearby. They're able to quickly walk to classes. They're not worried about negotiating with landlords. The possibility is there for really revolutionizing the community college experience for these individuals. And now this doesn't fund that housing, but it gives community colleges the ability to actually begin providing housing to students. And I think that's really exciting.
This is a great initiative. I would bring up the webpage that is reporting on it, but it's Crane's, and I'm not subscribed to it. But I think you did a great job summing up what the contents are of that story without it being up on screen. And really quickly to Trish Taylor in the live chat, yes, I am intending to have some homeless people on the panel. It's not going to be all of us talking about it. We're hoping to have some actual people who are in the homeless community here in Chicago participating in that panel.
Yeah. We're also going to move on. This story. Our dear friend E. Heller was able to help us out with this.
Yep.
A Chicago pharmacist has been arrested for selling vaccination cards for $10 each. Now, there has been this industry in these stupid vaccination cards. I guess, for example, they've been seizing packages. Feds have been seizing packages of these fake vaccination cards. And apparently there was a pharmacist here in Chicago on the South Side, I believe, who was selling these vaccination cards for $10 each. It's a complete betrayal. Granted, these cards should have been pocket sized. They should have been wallet sized. I will never understand why they made them the size that they did. But the reality is that these are people who don't even want to bother, seeking a vaccine, and they're getting these cards. And this is somebody, a pharmacist. You need a lot of education to be a pharmacist. You have a fairly high level professional license. Pharmacists have an enormous responsibility, and to know that a pharmacist was doing this is really awful.
And I keep thinking back to Lollapalooza. Show us your cards, okay. Show us your cards, okay.
Yep.
Or any public event that's happening right now. Yeah, this is a complete betrayal by this pharmacist, and I hope that he suffers whatever consequences they throw against him, because he's just adding to the problem. And as far as like the size of the vaccination cards, it drives me crazy too, because I brought it out I carry it with me if I go to a public place just in case I need it. And invariably you have to shove it in your pocket, and you pull it out of your pocket. It's all crumpled and stuff. And I have to flatten it again in a book instead of who thought of like designing them this way instead of something that you could fit in your wallet properly. And we
live in an ID nation. I mean, I guess, we're unique in the world, in the U.S., is that everybody is expected to carry an ID with us. And the one, you had one job. You had one job, federal agency, and you couldn't even do that right.
And we've got a fantastic suggestion from one of our viewers in the live chat. You can get a vaccination card for free. Just get the goddamn vaccination.
What about that?
What a concept.
I went to Wrigley to get mine. And I got to tell you, it was one of the most impressive processes I have ever been through. It was very well managed. I was in and out very quickly. I was expecting to stand in line for hours. I was in and out so quickly.
Yeah,
it was unbelievable. Yeah.
Yeah. Just get it. So Arturo Medina in the live chat is saying that I didn't realize this. He'll be charged on at least 3 counts to carry a sentence of 10 years per count. I hope it was worth it for the $10 per card. This guy.
Yeah. And he's going to, and think about that student loan debt he probably took to become a pharmacist.
Right.
Well, and he's going to lose his license. I'm quite sure he's going to lose his license. And,
he was to serve the public trust, and he couldn't even do that, talking about having one job.
Yeah, one job. It's all you had to do. One job, dude. And I hope it was worth it.
Yeah.
Whatever it is, what you were doing with those cards. Going to move on to, where is this? Hold on.
This is a
Oh, wait.
scary story.
I'm sorry about that.
That's okay.
Very awkward.
This is a
Essentially
really
what's
scary
going-
story.
Yeah. Well, the city doesn't know what it's going to do about finances.
This is from Lightfoot's. Should we at least play from Lightfoot's? This is her press.
Why don't you do that?
Yeah, I think that's yeah. We should hear what she has, what uselessness she has to share.
Yeah.
Chicago's fiscal picture is less bleak than it was this time last year. That's the message from the mayor yesterday when she released figures that showed the coming year's budget to be about $733 million out of whack. That's down from a gap of $1.2 billion last year.
Doing the math, this $733 million projected gap for 2022 is 40% less than the projected gap for this year, 2021, meaning that we have shifted from a pandemic budget to a recovery budget.
And here to tell us what this all means for Chicagoans are Amanda Cass, Associate Director of the Government Finance Research Center at the University of Illinois, Chicago.
Lainie, how far should we go in this that you weren't prepared?
I don't think we have to go too far.
Okay.
I mean, what I'm going to say is this. I think the key thing here, first of all, the mayor is talking about a recovery budget rather than a pandemic budget. With all respect, we're not out of the pandemic.
Not at all.
And so I think talking about recovery is entirely too premature. We're already going back to indoor mask policies. We've got this Delta variant. And Daniel and I over on Hard Lens, at the beginning of all this, because I was doing some volunteer work in the city, Daniel and I had a talk about when we thought the pandemic, a lot of the most of this pandemic, the disruption, so to speak, was going to be over. He figured in the summer of 2021. I said, no, I'm going to be looking at late winter, perhaps spring of 2022.
Yeah.
And that's what I expected, just because of what I was being exposed to in terms of what I was hearing from people. The bottom line with this is when it first came out, they were calling it the novel coronavirus. Now, what I find fascinating here is that nobody, in the CDC or any of these public health agencies thought to define that for the general public. Novel doesn't mean a book in this case. What it means is new.
Unique.
It's new. And the cool thing is that all I had to do when I was talking to people about this is I would say to people who would be panicking, I would talk to them, I'd say, look, this is novel means new. This is a new virus. We're all learning about it at the same time. That usually calmed people right down. What I'm finding is in these situations, it's far better to presume intelligence than unintelligence when you're talking to people. Because they, once you just basically say, look, this means something is new, they understand that. They can grasp it. They may not be familiar with certain terms, but once you put it into layman's language, they can grasp it just fine. They just don't have the same vocabulary, but that has nothing to do with whether a person is able to be reasonable. And people grasp this. And the thing is, it's new. We've seen how it's changing. We see how it's continuing to change and mutate. People are saying that this may very well go permanent and become an endemic, and it may very well do that, and we will manage it. But I think that it is entirely too premature right now to be talking about a recovery economy. I would like for us to recover. Nobody wants, I want us to recover. I'm a human being. I want my life back. I think we all want our lives back. And that's what we want. We want to go back to the way things were before, which I don't think is going to be entirely possible. But I think that we do want to be able to lead fulfilling lives and have social lives again. But the reality is we are not yet fully into recovery. For one thing, a lot of businesses took serious hit, businesses that are still shutting down and may very well start shutting down again with the mask mandates. We don't know what the outcome of this is going to be yet. But basically what is going on right now is we've got deficits in this city. And I know that, Tom Tresser has talked about how, Chicago is not broke. That a lot of this involves mismanagement of funds, but I'm going to say at the very outset, I don't think we can talk about a recovery budget yet.
E. Heller in the live chat. How much money are we spending on CPD? Exactly, E. Thanks for that. And Mayra Sanchez says, yep, too much.
Yeah.
Yeah, no, you're absolutely right. And I think that unfortunately, it doesn't seem that this present or past, and I don't want a broad stroke here, but it doesn't feel like present generations understand, like previous generations, that you have to sacrifice a little to get things to normal. And this rush to reopen and people complaining they've got to stay home or they don't want the vaccination, their body, their choice is exactly why where we are now a year later. And I expected the same thing was going to happen. I think, although Daniel likes to say that we don't repeat history, it just rhymes, looking back at the 1917 and 1918 pandemic, which I always point to, you look at the charts and the numbers now, everybody thought in 1917, oh, we're out of it. Let's start reopening, doing things normal again. Bang, 1918, back to where they started from. And if there was anything that could be a barometer to give us an example of how to avoid this, it was right there. And nobody wanted to pay attention and nobody cared. And it just boggles my mind. But a lot of things boggle my mind, Lainie.
A lot of things boggle my mind too, and I think that's one of the reasons why we do these shows. Why we, I think some of us have really doubled down on our media work because we realize that we have to do something and we have to continue to make these connections and to talk with each other. I think that one fear that I do have is that coming out of this, and as there is a real genuine recovery, are people even going to want to work with each other ever again? I think there's been bounds of trust. We have a low trust society in my view, and I think that there's going to be perhaps less trust, and it's going to make it harder for a real recovery.
When I say it boggles my mind, it's because we're living in the 21st century now. And I always imagine once we got past the 20th century to the 21st century and we have enlightenment and smart people and education, more people going to schools, more people being educated, that this kind of stuff would be behind us. But I was wrong. So.
Yeah. Finally, and just to kind of close things out, we're Gen Xers. So we remember a time when area codes were for when you were calling, say, out of your area.
Yep.
And you never needed an area code to call somebody in your own town. And then we started seeing things like the 708 area code. And then they just started, people, if you were in the Chicago suburbs, you were 708, 312 in the city. And then it just started to multiply all over. And it's just astonishing to me to think about how we used to conduct our lives. If you go around some old-timey areas in the city where they still have the old signs, you'll actually see business phone numbers on doors and on signage that don't have the area code.
Yeah.
And I bring this up because Chicago South suburbs are getting a new area code.
Crazy. We're running out of numbers.
Yeah, 464 for the 708 region. So it's probably going to happen around January. And I felt like we had to close out the show with kind of a fun story where you and I could reminisce a little bit. And just, the fact is that we've become a telephone society. Funny story. My mother, many years ago, probably actually it was around 1980. She had a good friend who married a consumer programmer. And this friend of my mom said, the future is not in computers, it's in telephones. And my mom thought this was nuts, but look what happened.
I think I lived through 3 area codes for where my parents live in Wilmette, from 312 to 847 to 773. And I think it's at 773 now. But and I'm 55, so that's 3 area codes over 55 years. Interesting.
Yeah, fascinating. So I just thought it was a fun story. I wanted to share it with folks to close out the show.
Be prepared, South Suburbs, in January to update your caller lists, or your not your call log, your phone contacts. That's it. Your phone contacts.
Your phone contacts. Yes. See.
Well, listen,
I remember
Lainie,
when we used to have yellow pages and we used to have phone books.
I remember
you
those.
actually had your own little spiral notebook, and then you would have your friends and family listed in there.
And if you didn't have that, it graduated on to calling 411 information. Now we
Yep.
just have our cell phones for everything.
We do.
As we bring the show to a close, I wanted to share with our viewers. I just put up a Cafe Press store for Chicago Corner. So I want to let people know YouTube doesn't monetize the channel, or at least they won't until we hit 1,000 subscribers. And I just upgraded our StreamYard account to HD. So hopefully you'll be getting a better signal as we broadcast from Chicago Corner. But it does cost a few dollars. So if any of you are so inclined, I created some nice Chicago Corner swag. Right now I'm using my Batman mug, but that will soon be replaced by my Chicago Corner mug. We've got men's and ladies t-shirts in there, and also a really nice Chicago Corner wall decal logo if you're so inclined to support the show that way. It could help. If you don't want to, you don't have to, but there is a link down in the show description. So yeah, check it out. It's some fun stuff that can help support the show until we hopefully reach 1,000 subscribers, which is why we beg you every week. If you like what we're doing here, please share the link to the show. Ask your friends to like and subscribe. We're really excited at how we've been able to build the channel with all the wonderful personalities that join me, co-hosting Lainie, Daniel, Kit, Jose, Kira. But until YouTube gives us some support, we're hoping maybe you guys can support us too. So with that said, Lainie, I want to thank you so much for joining me again to co-host. It's always a pleasure to have you here. Anything else?
Coming on more often. I'm sorry I've
Please,
been remiss, but I'm a freelancer, and you know how it is when you get multiple projects at once. That's what happens. But I'm looking forward to coming back on the show soon.
You've had a good excuse. You've been busy. Anything else you want to share with our viewers that's coming up before we end the broadcast?
Not at this time. I would just urge people at this point to be monitoring the news so that you know what to expect. I know that many theaters and venues have been trying to open. We know it's all up in the air at this point, so it would be a good idea to monitor their the social media pages for those venues, just to see what they're doing, find out what their ticket refund policies are or exchange policies. I know that everybody really wants to get back to normal life. We want to support these businesses and the arts that we have in this city. So staying in touch with your favorite venues can be a great way of doing that right now, because they may still be doing streaming shows, a bunch of things you can be doing to help support the city right now. But I think a lot of it's going to be sit tight, stay informed, and look out for each other.
With that said, I want to tell everybody in our audience, please stay safe. And if it's happening on the streets, you'll hear about it here on Chicago Corner. I'm so proud that I was able to coin a phrase to go with the channel.
It's awesome.
Good night, Chicago. Thanks, everybody.
Take care.
And thank you, Lainie.
Thank you.